Well, maybe you know October 15th marks the start of the Medicare annual enrollment period. And let's be honest, with inflation at an all-time high, seniors really need to make smart choices when it comes to their Medicare. So today we're going to talk with Bob O'Connor, Vice President at Aetna Medicare, to discuss the annual enrollment period and ways to best be and make smart decisions. Bob, it's good to see you. How are you?
I'm doing well. Thanks for having me, Natalie. How are you doing today?
I am well, too. You know, this is such an important topic and it affects so many people. So where can we begin today with making sure smart decisions are being made?
So I think people need to think about a couple of key items. One of them is what is their monthly budget, and what is the insurance that they might be on costing them currently in terms of the premium, in terms of the copays and everything else, taking a look at the networks, doctor, hospital, are they in the network? I think one of the bigger things is prescription drugs. And so those programs are all different depending on the insurance company, and those change year over year. In fact, at Aetna, we took nearly 300 medications and we decreased their costs dramatically. They went from $45 or $90 a month down to almost nothing, zero or a very low copay. And so if you think about if somebody's on one or two medications and nearly 80% of seniors are on two or more medications, that's a big savings. And I think the big thing is that there are new extra benefits that have been added this year. And so people really owe it themselves to take a look at what's out there.
Well, that's exactly what I was going to ask you about. I mean, we want to try to get the most bang out of our buck. I feel like we need to take that same analogy when it comes to Medicare. How do you make sure you're getting the most out of your plan?
Yeah, so I think it's about doing a little bit of research, the good news, and I'll tell you a little bit later about some of the resources that are available. But some of the programs that people should be looking for would be, coverage for dental, vision, hearing. As we all age, we all need some more of those things, whether it be eyeglasses. The neat thing is that the programs have extended and expanded. They used to just cover maybe cavities, X-rays, cleanings. Now there's coverage for root canals, for crowns, for even implants. And I think the really neat thing is, we all know what kind of pressure that people are under financially, fixed incomes and so forth. And there are, so many programs out there that will cover some things that are already maybe in your monthly budget. So maybe you're going to the gym. Well, the Silver Sneakers program will cover that fitness cost for you on a monthly basis. We've even added programs that cover things like utilities. And so electric bill, water bill, even the internet bill, it all adds up. It's in your monthly budget right now. We have cards that will cover that. And also healthy foods. If you've been to the grocery store lately, you come out of there with just a couple bags, it's costing you over $100. Well, coverage for those pricey, healthy items, healthy produce, fruits and vegetables, good meats and other proteins. I think it's important to find a program that will take those items that are currently in your monthly budget, and move it to your health plan.
I love that. It's things you're already paying for, so why not put it under that umbrella? I love being able to talk this and share this information with our viewers. Hey, before we run out of time here, let's talk about ways to save money. At the end of the day, it's kind of how we started this segment. What are your final thoughts that you want to make sure and share with our viewers?
So I think the important thing is to, research and find a program that will cover those things that are right now in your budget. And I think it's also, going out there and finding the resources. There's local agents right in the area that are experts, because healthcare is different in Tampa versus Miami. It's different providers, different benefits, different insurance companies. And so finding out more, you can definitely go on to some of the online resources. Medicare.gov is a great program the federal government has out there. Just put in your zip code. You can see what plans are available in your area. And we also have a lot of resources online at AetnaMedicare.com where you can learn all about the plans, but also find out a lot of other things you should know about Medicare.
I'm so glad you threw that website out there. It's actually at the bottom of the screen where everybody can get to it. And it can be an overwhelming time for people. So I'm glad we were able to have this conversation today and you were able to share those resources. Once again, Bob O'Connor, thank you very much for being with us.
Thanks so much. Appreciate it.